This is April Van Buchen, Nursing 136, Pharmacology, Chapters 56, 57, and 58. Chapter 56 starts with dermatologic drugs. Lots of different dermatologic drugs. They're used for all kinds of things. Some of these drugs I'll mention here while on the slide. Others have their own slide. Others are on the slide that I may never even mention again, because my hope is that you know what they're used for. Sunscreens, for example. I hope all of you use sunscreens. I hope you know what they're used for. And some of these other drugs, I really just hope you know what the name means. Antipruritic drugs. Do we know what this is? It's itching. We need to know what this is. Emollients. They're used to soften the skin. Topical vasodilators are used to perfuse the area. You would put a topical vasodilator on the fingers of somebody who has frostbite, right? Because you want to perfuse. Debriding drugs. Those kind of drugs promote wound healing because they debride or remove the dead cells. Topical anesthetics. Anesthetic is pain relief. So topical would be used to reduce pain associated with things like bug bites, sunburn, poison ivy. They're also used to numb the skin before a painful injection or an IV. Like if you have a little kid and you have to give the kid a shot or start an IV, you would put something called EMLA cream, E-M-L-A. It's a mixture of lidocaine and prilocaine, so those are numbing agents. Leave it on for a few minutes, and then you can stick that kid. They won't even, well, they'll feel it once you're under the skin, but they won't feel you sticking them. So it really helps. There are drugs for topical parasites. You'll know topical parasites are things like scabies. You can buy something called Quell, K-W-E-L-L for scabies. There are topical drugs for hair growth. You'll know the name Rogaine. That's a topical hair growth drug. So all kinds of drugs that go on topically. You should be familiar with some of these antibacterial drugs. The ones you probably aren't familiar with are Bactroban. That's prescription. It used to be used a lot, but because of the high incidence of infection with MRSA, MRSA, methicillin-resistant Staph aureus, the Bactroban or mupirocin is now resistant, becoming resistant. So we don't use it as much. The other drug that you might not be familiar with on this slide is silver sulfadiazine, Silvadene. So it's called Silvadene cream. It's the only brand name. People use it in the hospitals all the time on burns. So second and third degree burns. When you have a second or third degree burn, your biggest risk is infection because your body's surface area is open, and they use Silvadene cream to prevent the infection. Anti-acne drugs. Did you know that acne is caused by a certain bacteria? Propionibacterium acnes. That's the bacteria. Benzoyl peroxide is the most commonly used drug to help prevent acne. It's bought over the counter. It releases oxygen, and so that's what kills the bacteria. The other ones that you see, erythromycin, tetracycline, clindamycin, all these are, most of them are antibiotics, and so that's the antibiotic properties will kill the acne. And then you've got vitamin A acid, which is retin A. Retin A is just used to regenerate skin growth, so it's used for people with skin damage, aging, like colored spots or fine wrinkles and acne. It just stimulates the turnover of epithelial cells. It results in peeling of skin, but new skin is produced. Acne meds' adverse effects are usually just local inflammatory effects. The peelings, flaking, redness, and when you stop the med, those effects stop. Fungal infections are difficult to treat. I hope you remember that from the systemic fungal infection section. It takes several weeks to a year to treat topical fungal infections. These type of infections are caused by something called candida. It's in the mouth. For women, it's in the vaginal area. For anybody in the intestinal tract, there's ringworm infections, athlete's foot, or actual ringworm. Those are fungal infections. And the medication that's used. So if you have a fungal infection in your mouth, you can use clotrimazole. There's a lozenge that you can use, and there's a wipe that like a thick liquid that you can wipe around in your mouth, but you have to touch all areas of your mouth and rinse really well. There's miconazole, which is a topical cream that can be bought in various strengths over the counter. Most of the time it's in the women's section. Usually it comes as a vaginal suppository cream, but you can use it for ringworm. So you can either get an expensive prescription or you can go buy some Monistat, put it on the ringworm. There are topical antivirals. Both are used in treating herpes simplex 1 and 2 viruses. They do not cure viral skin infections, but they reduce healing time and pain. You have for viral skin infections or any kind of viral infection, you need systemic drugs. Systemic drugs, you guys, are drugs that you take in your mouth or an IV form that go throughout your whole body. Drugs that you just put on your skin, topical drugs, are usually called local drugs. So local or systemic. Let's see. Antihistamines and corticosteroids will have anti-inflammatory effects, and they work for the antipruritic needs. And then there are anti-psoriatic drugs. So psoriasis is an autoimmune inflammation. Its features are a red, scaly rash, and so when you have psoriasis, you need an anti-psoriatic drug. Most common, Enbrel. There's TV ads, so you know it. When there's TV ads, it means that it's expensive and it's new. So all of these are the anti-psoriatic drugs, and they're primarily new. But if you have psoriasis, you've got itching, red, scaly skin. It's often embarrassing, and you have to put anything on it because it's really uncomfortable. Wound care, skin prep drugs. There you go. Skin prep drugs are drugs like if you're prepping the skin for surgery, you're going to wash it with chlorhexidine, which is Hibiclens. It's a red pinkish solution. So if you guys do a clinical and go into a surgical area and you see a pinkish solution, that's Hibiclens. Betadine is more of a brown solution, and they'll pour it over an infection or an area that they're about to cut to do surgery on. So there's all kinds of skin prep stuff. Alcohol, that's what you're going to wipe with when you start an IV. So we call them skin preps. And wound care drugs, when you're doing your wound care experience, you might see some of these drugs. They've been used for years and they really, really work. People put aloe on burns. So that's your herbal for the day. Nursing applications. You want to, with topical products, you want to make sure that they are properly applied. You want to use gloves. You want to put whatever dressing that you need to on them. You want to document what the skin looked like before you applied the medication, if there was any draining, if there was any swelling, what the temperature was. So you want to document everything that you possibly can, and you want to follow the manufacturer's guideline for administration. Chapter 57, ophthalmic drugs. I hope you know what this means. It means drugs for the eyes. I included this picture so that you know the different parts of the eye. Do you have to memorize it? Am I going to test you on it? No. But I would be embarrassed if I were a nurse and somebody mentioned something about macular degeneration or a retina problem and you didn't know that that was part of the eye. Here's another one. Look at all the muscles. Lots of muscles on the eye. So, optic drugs. There's different classes of optic drugs. So there's mydriatics. Mydriatics dilate the pupil. Miotics constrict the pupil. And cycloplegics do plegic. They paralyze. So they don't paralyze the pupil, they paralyze the ciliary body. Some of them could also dilate. So they have mydriatic properties. So I recommend knowing these terms: mydriatic, dilate; miotic, constrict; cycloplegics, paralyze the ciliary body; and some of them have mydriatic properties. So when you talk about cycloplegics, a term that comes to mind is cycloplegia, which is paralysis of the ciliary body. So before you learn about glaucoma drugs, which is what I'm going to talk about for the next few minutes, you need to know a tad bit about glaucoma. Glaucoma is inhibition of the normal flow and drainage of aqueous humor. When that fluid doesn't drain, it results in increased intraocular pressure, and that pressure destroys neurons in the retina, and it leads to impaired vision and eventual blindness. This is an interesting slide because it shows the flow of aqueous humor in the eye, and then the flow chart below it. It helps to explain the increased aqueous humor increases the intraoptic pressure, which puts pressure on the retina and impairs vision, just like what I said, but it just shows you a little better. So basically you have difficulty adjusting far to close or close to far when you have glaucoma. I have early stages of glaucoma, and if I'm looking down reading and then looking up, I have difficulty adjusting. When I go outside, if I'm going from a darker environment into the bright light, I have a difficulty adjusting. Glaucoma is caused by so many things. They think mine is caused by sun exposure. You can have angle closure glaucoma, you can have open angle glaucoma. When I just said glaucoma is caused by many things, even sun exposure, it can be primary, secondary, or congenital. So, glaucoma drugs. Man, there's a lot of them. Look at all this whole list. Everything bulleted is a different type of drug that's used for glaucoma. And I hope some of these are familiar to you. Cholinergic, sympathomimetics, beta blockers, diuretics. All of these drugs work in a different way, and they reduce intraocular pressure. They're used for glaucoma. 3 types of antimicrobial drugs, just like in the dermatologic chapter: bacterial, antifungal, antivirals. These are some examples of them. So most of them are the same. They're just a different form that's appropriate for the eyes. Anti-inflammatory drugs help reduce pain, redness, and inflammation associated with all kinds of stuff. After surgery, after eye surgery, they're given to patients to help prevent the inflammation and pain that would be caused. Topical anesthetics are used in the eye. They're used to prevent eye pain during surgery, during examinations, removing foreign bodies. Here's my example. My dog got a splinter in her eye when she was about 3 months old because she was running around with a stick, and another one of my dogs tried to grab it, and all of a sudden she had a stick in her eye. So they had to put a topical anesthetic in so that they could remove the little stick so that it wouldn't hurt my dog. And even, gosh, when my kids were in high school, one of my daughters had some kind of something in her eye. The ophthalmologist said it was from not washing her makeup off, and probably mascara. They numbed her eye up so it wouldn't hurt, and he used a Q-tip to remove it, and charged me $400. So any kind of topical anesthetic for the eye just allows them to do whatever they need to do. Drugs that diagnose are interesting. So the drugs that diagnose are in the category of mydriatics. So what is mydriatics? What does it do? Dilate or constrict? Think about that. So there are several drugs used to diagnose. These are the big ones, but it's the dyes that I find interesting. So putting a dye in the eye, it makes whatever's wrong really stand out. So ophthalmic dye. It'll identify a corneal defect. It'll identify foreign objects. It'll highlight them in weird colors. It's pretty interesting. Whoever realized that putting a dye in the eye would really help them to diagnose. Other ophthalmic drugs are listed here. Let's see. Antihistamines. Can you believe it? There's an ophthalmic antihistamine used to treat symptoms of hay fever, like allergic conjunctivitis. Lubricants, like artificial tears or Restasis. And you teach people how to put the eye drops in. And if people have, some people have 2 or 3 different kinds of eye drops for their glaucoma, and they have to wait a few hours in between. You've got to know this and teach them this. Ointments are applied in a thin layer in the conjunctival sac. You have to know not to touch the eye with the tip of the dropper. What if somebody has a really shaky hand? Maybe they need to find somebody else to put their eye drops in. So you can't just say, here's your eye medicine, go home. You have to know, can they do it? Do they know how? Do they need help? How often do they do it? Otic drugs. Those are ear drugs. So to understand drugs for the ears, you have to know a little bit about ear disorders. So you can still have bacterial and fungal infections. You can have inflammatory infections. You can have problems with the outer ear, the middle ear, the inner ear. And if you have inner ear problems, it really hurts. Most often, middle ear infections affect children. And these kids will have pain, they'll have pressure, they'll have a fever, it'll be red, and they'll be pulling on their ears. It just really hurts them. Meds used for ear disorders are antibiotics, antifungals, anti-inflammatories. That you can put an anesthetic in the ear. You can put a steroid to reduce inflammation in the ear. And then there are medications to get rid of the earwax. So all kinds of different things that go in the ear. The biggest thing that you need to know as a nurse when administering ear medication or when teaching someone how to administer ear medication is how to do it. It's how to apply the medication. When administering ear drops to adults, you hold the pinna of the ear up and back. When administering to children younger than 3, you hold the pinna down and back. You allow time for the eardrops to flow in the ear canal. So you have them lie on the side opposite, have the affected ear up for like 5 minutes after you put the drops in. Maybe put a little cotton ball in afterwards, but don't force it too far in the ear canal or it'll just absorb the medication. You could even massage a little bit to get to encourage the medication to flow down into the ears. So now we're at the sample questions again. I want you guys to do them on your own. Some are answered and some you have to look up, and the exercise of looking them up really helps you.